living in extraordinary times where things seem to be changing every single day. And to keep up with all of the changes is pretty impossible. But what we want to focus today on is how might we think about new ways to help improve individuals' health, families' health, populations' health. In this podcast, we focus in on the tough trending topics, and then we sort of go into some of the data that helps us kind of unpack what might we be doing to separate out the signal from the noise for what we could do as individuals and as communities. I'm Sharon Kardia. I'm a faculty member at the School of Public Health at the University of Michigan, and we're super excited to have Paul Fleming, who is also a faculty member in our fabulous Health Behavior and Health Equity Department. Um, Paul, you've just written a book
I
called,
did.
that's right, called Imagine Doing Better. And I have to say, when I read it, that I felt like, gosh, this book could be read in high school. It could be read in college. It could be read by graduate students. It could be read by my grandmother because of the way in which you make it simple, you make it fun. I mean, you've got some wild stories in there about, how we might change our minds around traditional things. One of my favorite is the example of just a couple of hundred years ago, standard of medical care was bloodletting, right? We wouldn't do that these days. Well, why did they do it and why did they do it for hundreds of years was a mindset. And you're really talking about kind of a new mindset and how anybody can kind of do this. But then we'd also want maybe our elected officials to do it. Maybe the people within sort of our governmental agencies for public health would do it. Maybe our criminal justice people would do it. So we're going to spend the next time, kind of half an hour just talking through from your perspective some of these deep topics. And one of the premises is that our policies fail us. And so they're not really reaching the kind of key needs of our society. So maybe you could start by telling a little bit more about, you know, if we're going to imagine doing better, why are policies failing us and how might we actually get around that?
Yeah, absolutely. And thanks for having me here. I think, one of the ways that our policies fail is we just aren't actually being led by communities and what communities perceive as their solutions. So much of our policy making that happens at the federal level, but also in our states, is taking what we have and bringing together people who are kind of policy wonks or politicians and having them make these really small micro decisions, sometimes bringing evidence, but also sometimes cherry picking evidence. And what we end up with is, kind of can be sometimes a little bit of a monster, right? It's actually what policymakers 100 years ago thought up based on very little evidence, and then it's been built on and tacked on and changed in small ways over decades. Part of what I think the book invites us to do is to think about how do we actually imagine different systems. Not to say that it's easy to completely transform systems; it's certainly not. But what if that's our starting point? What if we think about what is it that we actually need, want, what would actually support healthy communities rather than just looking at what we have now and saying what's the little tweak
Tweak
that
that
we
we
can
do.
make? Yeah. And so it's asking us to think about policy making different. And I think, those of us in public health know that we have a lot of different tools to bring to the conversation. I think during the pandemic, a lot of people saw some of our tools for epidemiology and other things, but the field of public health, as you know, is gigantic, and we do a lot of work in partnerships with communities. We do a lot of work outside of just health policy, but thinking about other policies. And so part of what the book is doing is bringing some of those principles related to prevention, because at the core of public health, we are thinking about how do we prevent harm in the first place. And a lot of what our current policymaking does is it looks at harms that happen to a community or a person, and it tries to clean up the mess afterwards.
Mhm.
And what I hope and I think the field of public health hopes is how do we shift policies to prevent things before they even happen in the first place? And that's really what communities that thrive could be.
Oh, yeah. I mean, we've had basically an entire century of doing that kind of preventative work and have saved millions and millions of lives. And people don't even actually know that that seatbelt that they put on actually has saved millions and millions of people's lives.
Hmm.
So I want to take you to the preface of your book, where I was so glad to see you take the kind of mindset from the Native Americans and the Iroquois Federation of the seven generations. If
Hmm.
we really sat here and thought about our great, 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 great grandchildren, what would we want to put in place now? And when you were talking about the way that, legislators or policy wonks or whoever is making the policies think, they're not thinking long term. They're kind of like short term gain for long term pain
Mm,
rather than short term pain for long term gain. Right. And there's this big difference
yeah.
between I'm going to put on my seatbelt and it's a little bit of a pain, but in that car accident, I saved my sister kind of thing,
Hmm.
right? So when you think of like one of your favorite examples of that, so I just use seatbelts.
Yeah.
What is it? Like a prevention that really made a big difference because your book is so much about this mindset of "Oh, we can do this.
Hmm.
Individuals can do it, families can do it, a society can do this."
Yeah, I mean, I think when you go back to some of the early days of public health, we were much more in communities. I mean, I think about sanitation. Cities used to be very dirty places, and there were a lot of diseases floating around. And public health was part of that, linking up with other communities or other members, and thinking about how do we work towards, how do we organize, how do we bring people together to build safer communities for us to live, safe in the sanitation sense. And so I think that's another example
Like
of
water and
yes,
workplaces
that's
and
right.
schools and those kind of day in and day out experiences for people.
Yeah, because I mean, infectious diseases at that time were rampant, and how were they getting transmitted? I mean, it's the classic public health example of the water pump, and that was a spreader of disease, right? And so I think that's one example. And back to your point about the seven generation thinking, there's a quote I really love by Brett Dennen that says, "I'm planting trees I'll never climb," and that's really to me that feels powerful of like the mindset we all should be having towards how we steward our public policies. So much, I think part of it is our politics today. There's other reasons, but it's this short term thinking. But ultimately, we are stewarding a country, we are stewarding communities that are going to last for generations. And so we owe it to our ancestors, and we owe it to the future generations to shift our mindset and keep them in mind, because they're going to live in the world that we're creating right now.
Mhm, mhm. So you know that that's a rare perspective
Hmm.
and that so much of our world is set up towards this, again, this short-term gain, kind of at all costs, and not really thinking about, all right, what would be best for my children and my children's children decades from now. And if you think about, you know, when you created this book, you must have been thinking about this, but what were some of the other motivations for this book? I mean, you've got an illustrative career in, health behavior and health equity. Why this book?
Yeah, I mean, great question. I think part of the motivation for this book, I have 3 kids at home, and so I think a lot about, oh man, what are they going to think about the world that I'm passing down to them, and what am I doing about creating a better world? So that's a big motivation for me, and not just my kids, but I'm part of a community. I send my kids to school. There's a lot of the next generation that I get to see and interact with,
Mhm.
and so that's just a big motivator for me. But I think the other piece of it is I've through my work, one of the things I love is I get to work alongside communities, community-based organizations, community organizers that are, pushing for social justice. Um, and I feel super lucky that I've gotten to soak up a lot of that wisdom and knowledge along the way. And I think there really are folks who are changing the world in these important ways. And I've been lucky enough to get to absorb that, learn about it as part of my career, alongside sort of the more formal
Mhm.
education that I've received, working alongside, brilliant experts here and everything. And so the more I thought about this question of like, how do we make a better world possible? How do we think about the work we're doing? I just felt like there were so many lessons that we aren't talking about enough. We have in public health, but also just communities have so much to share. And this I think about the book as sort of collecting some of these different things. So they're not. This book is not full of my ideas, but it's
Mhm.
rather trying to like collate and collect some of this really important wisdom that different communities have. And hopefully it inspires folks to like shift that mindset.
I was inspired by the way you laid the book out because you basically have got 3 sections. The first is basically in the imagination space.
Mhm.
Let's imagine,
Yep.
right? Let's imagine what the world could be like, right? So imagine doing better. And then that reflection, like going into and pawing through, okay, here's where we are, and here's where we've done well, and here's where things have not gone well at all. We got some chronic, issues, and including some of your subtitles, like, the environment, living in a burning world, the being upfront about the fact that things are going off the rails.
Mhm.
And then that last piece on action, because everybody wants to know, well, what am I supposed to do?
Right.
And your topic areas there being both individuals, what can individuals do, and then what can communities do?
Mhm.
And I wonder if you could speak a little bit about this transition between people and community. Because right now, I feel like in the United States, we have lots of individuals with strong feelings and strong ideas, strong fears, but actually forming groups that can have kind of collective action. Because as you sort of started the conversation with me, you really pointed to the fact that, well, communities aren't making these policies,
Mhm.
right? We've got people that were elected, but it's still within a very few number of people who are actually making those. And to be honest, even as an informed citizen, I don't look at the legislation.
Right.
I just look
Right.
at the repercussions. How does it influence my bottom line or my freedoms or whatever are the things that are, I'll call it top of mind for me, but everybody does that. So how do we actually start to understand, well, we can't really actually live as isolated islands. We live in communities. But how do people do that?
Yeah. Yeah. Such an important question. And I think, in our US culture, there's such a priority on individualism. And, of course that's important. We all are our own people and we all have our own needs and wants. But if you think about what actually makes people happy and thriving, it is that connection to other people that does that, right? Uh,
Fun and
Oh
getting
yeah,
together and doing things for a cause and making
that
things better. Yep.
that's what makes life worth living, right? And so we sometimes forget that when we are buying into this individual mindset. And so, I get and you and I both work with a lot of different students. I'm sure you get some of the same questions, but a lot of, people just feeling really stuck in the current moment. Like, I'm just one person. These, the policies that are happening, especially at the federal level, are just way too huge for me to even think about what can I do. And and of course there's some truth to that. One person cannot tackle all these things on their own. But once you start to get that mindset of you're not a person, if you shift your frame back to the community, like, who, Sharon, are you connected to? Who can you call up and say, let's get together for some coffee and talk about this issue and what we might be able to do. Now, are you and three friends going to be able to completely change our federal policy? Maybe not, but you and three friends can do a little bit of research and find out the organization working in your state to tackle this issue. And you can think about how you can contribute some of your efforts and wisdom and unique skill set to that thing, right? So you start to spread out. And so I think that's the thing, that we are often thinking about ourselves as individuals, but we are part of this ecosystem, and we do have some power to steer our own ecosystems in different directions. We have people that trust us. We have close relationships, and we forget the kind of power it is to just suggest something. One story I tell in the book is about, it's the story of a woman named Katie Fahey who, she was really concerned with political gerrymandering. She just threw it out to her Facebook community. I want to take on this issue. She's 27 years old, didn't have any political organizing experience, but people responded to her post. I imagine
Mhm,
that she had built up some trust with her Facebook friends and
mhm.
whatnot. They responded and they said, I'm in. She brought that group together. Eventually, it turned into a ballot initiative in Michigan that created a citizens redistricting commission that then, not to say it completely ended political gerrymandering, but it made it a lot better in
Mhm.
the state. And so that's not gonna everyone's not gonna be able to do that thing, but it is a lesson and inspiration for us all that we are part of communities in all the different ways, and that's what we have to lean on and foster. And when we think about public health, we've studied this thing. There's a lot of different evidence that shows that communities can come together,
Make a
create
big difference.
solutions, and they make better solutions, right?
Mhm.
um, and so that's kind of the thing that we need to lean on, is that aspect, rather than just kind of thinking of ourselves as isolated islands confronting these big problems.
So these institutions that you cover in the book, and Paul does an amazing job of making the information incredibly relatable. Great storyteller. So I deeply appreciate it. And your titles are also very fun. And I'm thinking about the one about better healthcare.
Mm.
Is healthcare like kindergarten or like soybeans? When I first read that, I was like, kindergarten or soybeans? What is he talking about? Maybe you could just give people a little bit of an idea of that, because
Yeah,
I don't want people to be caught off guard and be like, what is he talking
yeah,
about?
yeah. Well, that's the whole goal of a title, is
Making you
what's
wonder.
yeah what's going on here. um yeah, the titles were both fun and a challenging thing to do, because you have 10 to 15 pages, and you're like, how do I sum this up in a pithy little title? But the question of soybeans or kindergarten, what at its crux I'm talking about is, if we think about kindergarten, it's this resource that we just fundamentally believe as a society every kid should definitely get free kindergarten.
That's
Like,
right.
we would never ever think about a 5-year-old and say, well, you can have kindergarten if your family can pay $1,000 or something like
That's
that,
right. Can we
right?
have public schools?
Yeah, exactly. And we fundamentally believe, again, it's sort of a mindset. We believe that this is a right, that children in our society should be able to go to school. Soybeans is a commodity.
That's right.
It's something that you buy and sell. And we believe that, you don't have a right to soybeans. If you want soybeans, Sharon,
I gotta pony up.
yeah, exactly. And so that's the fundamental difference. And what that chapter is really about is this concept of health as a human right, which is a contentious issue in, I think, the broader society here in the US. But if you look globally, most countries do adopt this idea that health is a human right. We should not be preventing people from accessing healthcare because they cannot pay, because they do not have enough money. So it is not the soybeans that you have to pony up and pay for, but rather everybody is entitled to this thing, just like every kid is entitled to kindergarten. In the US, we've taken a different route. We certainly do have some programs that help reduce the barriers for people who are low income or don't have money to afford it. But at its foundation, our healthcare system treats healthcare like a commodity, like soybeans. And so it's a different path that we've taken. And when you think about the prevention mindset, throwing up barriers to something like healthcare, getting screenings for cancer, what you're doing is you're creating problems in the society. And then also, you're going to create policies to clean up that mess, right? Because what you've created is a sicker society. And that sicker society is going to be working less. It's going to be causing other issues for its community. As people fall ill, they're unable to take care of their children, they're unable to take care of older adults, et cetera. So it cascades. And then we try to create policies to clean up that mess. But if we shifted ourselves to just think about the fundamental right to health and healthcare at the outset, that's the kind of prevention thinking that we can do.
Is there any way to put together that prevention thinking? Because I'm thinking about, not just my family, but many other people I know where there are some people in my family who cannot afford healthcare. They have a health event. They put, they get, their foot fixed or whatever, and now they've got a $10,000 piece of medical debt they cannot pay.
Hmm.
And there's got to be millions of people that are in that situation in the United States. So, yes, all right. But now, what about the compensation model? Because I think that is one of the big things that people are worried about, that doctors and nurses and the people that are doing this hard work aren't going to be well
Right,
compensated to keep doing it, and then we get into a shortage of physicians, or we
right,
get into a shortage of healthcare because there's not enough economic, movement there to
right.
really sort of make it worthwhile, which is why it's been a commodity. Is
Yeah.
there any way to put those two things together where we've got healthcare as a right and it's still following this, I'll call it capitalist
Yeah,
model?
yeah, yeah. And I mean, I think the answer is absolutely. There's a lot of different countries that have
Figured that out.
figured it out, and we have folks in the School of Public Health that study that exact kind of comparative health systems, right?
Mhm.
And one of the examples I didn't necessarily know when you invited me on the podcast I'd be talking about my colonoscopy, but one of the things that came up in the book, or that I thought was really important to share, is I did at one point need to get a colonoscopy. Thankfully, everything was all good. But when that bill came, I have insurance through our
Clutch
employer,
up.
right? I had to pay, I forget the exact number, but somewhere close to $1,000 out of pocket for that thing that my doctor recommended. And then my insurer paid much more than that. They paid the
Right.
bulk of the bill. So that whole procedure, if I'm not mistaken, costed somewhere close to $10,000. Now, if you just travel 50 minutes from here, across the border to Canada, colonoscopies, paying for the doctors, nurses, and everybody involved, cost about $500 total. Their system has figured out the economics of it to make that happen and accessible. And by the way, the patient pays zero of that, right? So it costs the system that. And so the way our system, not only is it costing us as individuals, it is costing the society, because there's such inflated prices and other things going on, because it's a distorted system. And so I think one of the things we can do in the US is really, I mean, not only shift our mindset towards this health care as a human right standpoint, but also look to other countries. I mean, people in public health know this, but I don't know that everybody knows this. The US health outcomes are much worse than almost every other country, peer country, right?
It's a real head scratcher.
Yeah.
Lots of money towards healthcare, lots of money towards public health, and we're not actually making it as a country on the global scale.
Yeah. We spend the most per capita,
Mhm.
but then we have some of the worst compared to peer
Yeah,
countries.
maternal, and child health. I mean, infant mortality. We are basically
Shameful.
neck and neck with India.
Right, right,
Yeah,
right. So I think, and when we think, and this is where it gets to back what we were saying earlier, is, a lot of people think like, oh, well, what's the policy solution to that
what's the
thing?
silver bullet?
And we take our healthcare system and we're thinking like, what little tweak can we do? Like maybe we can add a tax break that gives people back $200. At its like fundamental level, we need to step back from the system we have that was created piecemeal over decades and decades and decades, not with some grand strategy in mind, but rather it just sort of policy after policy after policy, right? How do we step away from that and actually imagine what is the system we need? Like, what would actually make our communities healthy? How can we actually think about people having access? And then let's build that system. Now, I know that's easier said than done, but that's where we all have to have that mindset, eyes on the prize of what do we actually need?
What do we really want? I, I have to be honest, as you were just talking, I was thinking about how this moment in history where basically institutions are being broken apart, they're being defunded, all of this sort of, I'll call it catastrophe,
Hmm.
might have a little bit of a silver lining in that those cracks create new avenues where people might be able to come in and do some real change towards this long term, I'll call it thinking.
Yep.
And so, just for all the students out there across the country, this is an opportunity for you to think through, okay, how might we do it for the seven generations in a much different way? You
Yep.
know, from the ground up, or taking the good that remains and letting the stuff that wasn't really good
Right.
go.
Right.
I mean, those kinds of, how do we do this? Which brings me to kind of your third section of your book, which is transformation,
Hmm.
which
Hmm.
I found really exciting because so many academics, they sort of start with sort of like, here's the problem, and 400 pages later we still got these emerging problems.
Hmm. And we need
Very,
to study more.
and we need
Right.
to study more, and very little on what can be done. And transformation is a process that most of us don't actually even think we can do, right?
Yeah.
So what led you to put in a transformation section, and where have you seen it work?
Yeah. Yeah, I mean, one of the just kind of the inside process of writing the book, originally that last section, which I think now has about six different chapters in it. Originally that was one chapter, but then I kept
Kept
writing
doing
and
it.
writing and writing, and the thing there is that that is where the rubber meets the road, because I think, the previous parts, imagination and reflection, are, I think, vitally important. That reflection piece of like, what do we have, what does the evidence show? We certainly need to be doing that, but we also know a lot about what we can do. We know a lot about solutions that can work, and so we need to better focus on like what we sometimes call the translation piece of like, here's a thing that has been heavily researched. How do we put that thing into action? And so that's where I ended up focusing. I think what ends up being almost half of the book,
Mhm.
is on that piece, because that's where I think we really can put things into action. So I think some of the, as you noted, one of the starting points for transformation is, I think, actually looking inward at ourselves.
Yeah.
And some people have done a lot of that work. Some people have a lot of room to grow in that area, but I think at its core, that's something we need to be doing all the time, because we need to think about, how are we connected to this issue? A lot of people
So
sometimes.
that's one. How are we connected to the issue? What
Yep.
else?
Yeah. So how are we connected to the issue? I think the other thing is like, what is our role to play? Because it's not going to work that everybody does the exact same thing, right?
That's right.
You and I, as professors, as researchers, in the different communities that
We
we
can
live
do
in,
this kind of layer.
we have a certain role to play, right? We can help. I mean, one of the things that comes to mind for us is we can help gather the evidence. We are, consumers of evidence. We can tease apart, this is a good study, this is rigorous, this is not, right? We can do that. But not just for ourselves, we share that, right? We make the broader community aware of it. So some of those pieces of like, who am I, and how am I connected to an issue, and what can I offer, what role can I play in thinking differently? Then there's the piece about transforming communities, right? And I think in that case, we're thinking about, well, what communities am I a part of? And
So
that.
church or school,
Exactly.
or it could be political, or it
Yep.
could be environmental, or
Absolutely.
yep, yep. Could
Sometimes
be
it's
could be the knitting
geographic.
club.
Exactly. And those are actually powerful examples. You hear there are stories of like, we have a little book club that we meet on Sundays, and then all of a sudden somebody in that book club is like, let's do this thing, and they're having an impact. So those little things of what communities am I a part of, geographic, online communities, identity communities, and then how can you think about change within those communities? And one of the things I write about the book is you can think about how can that community sort of use its voice, leverage, whatever it is, to make change in the broader world. But then also that community itself operates in a certain way. There are power dynamics, there are sometimes rules and policies,
Always
right?
gets messy if there are humans involved.
Yes, right. Like, so I think about my kids are in elementary school, right? There's a PTO organization. The school operates in certain ways. It allocates funds in certain ways. It has certain events, et cetera, right? Those are all things that could be ripe for change. So if you're bringing sort of a prevention lens to that work, we start in our own backyard, or we start in our own neighborhood, and we think about what are the changes there, right? Where I think because of the news and whatever, we're so quick to think that transformation always is the starting place is that federal level, or at the international level. And of course that's important. But the role that we can play might be making change in our backyard. And so I think that's an important thread not to lose.
One of the things as I was reading through your book that kept coming up for me is I think in this next century, most public health and most of the change that we'll see and enjoy will be local.
Mm,
Right? Because our, watersheds, our food sources, so our healthcare, so much of that is on this kind of wonky edge and breaking apart that you have to go back to local. You got to go back to your family next to other families and neighborhoods. And what are we going to do when, I mean, the ice storm comes,
yep.
right? And now your infrastructure is gone.
Yep.
And, issues with the water supply, well, and the money runs out.
Yep.
If FEMA is going to be defunded or other things are defunded, it really means there's not a set of financial resources economically to pull up a solution. You're going to have to fix it locally. And that'll mean that each person in your, kind of geographic area, small or larger, has something to contribute.
Yeah.
Every person has got something to contribute.
Yeah, I mean that idea, builds on the concept of mutual aid, which humans have been doing forever,
Forever.
forever.
We never live alone.
Yeah,
We
and
always lives in clans and tribes.
but some communities, not all communities, have sort of lost the practice of it.
Sure.
The practice of leaning on your neighbors. You mentioned ice storm. I still remember. I think it was 2 years ago here in Michigan. We had a bad ice storm. I
That's
lost
right.
power for 6 days. I had, some my kids' friends from school were like, "Come bunk up with us for a few days." We went to the local library, right, which is another sort of community
Resource.
resource. And so those are the types of things. You're absolutely right that that mutual aid ethos of like, what do I have to offer? And not just what do I have to offer, but how do I make it available to people? Because especially in a lot of our communities, there are abundant resources, and so how do we share and make sure that those who don't have the same resources have it? And these, mutual aid societies are a really powerful example of not necessarily waiting for a higher government level to solve
Right.
problems. Of course, we want a society where a higher level government is doing those things. So I don't want to I don't want to abandon that effort to create governments that are responsive to community needs. At the same time, we can if we change our mindset a bit, we can think about how do we build the community that we need right now from the resources that we have right now, while we're also working towards that longer term policy change where government resources are allocated differently. And so those two strategies alongside each other can really help us get through these coming years.
So, personally, when you wrote the book, you must have had a favorite topic or a favorite chapter. Can you tell us a little bit about what that favorite was and why it was your favorite?
Am I allowed to say this? Feels a little bit like the question of who's your favorite kid, and you're not allowed to have favorites, right?
You are allowed to have favorites. It's your kid.
Yeah. I think I did I had fun writing the book in general, which, is an interesting thing because I know some writers say it was a slog to get through, but I felt like there was a lot of unique, there were opportunities for me to learn new stories, new examples, which I really appreciated. But one of the things that I think I really liked being able to pull together into a chapter was this idea about how we rethink or reimagine public safety in our communities. And part of the reason that I really like that is I've been involved in some efforts in my own local community about how do we build new resources for public safety. And the public health research on so let me back up. In When we think about public safety, the big thing people are thinking about is we use police and law enforcement to promote public safety in communities. And that's sort of the foundational thing that most people think of when they think of public safety. And when you think about a resource for public safety, most people think, well, the police is my resource, right? That's how we promote public safety. And I think, if we go back to prevention thinking and like how to think differently, there are some communities that are really innovating in this space, partially as a response to thinking about how police violence has harmed communities. We see public health research that has shown that, actually being killed by police is the sixth leading cause of death for young Black men. We see that,
So they are not actually thought of as public safety,
right,
right?
right,
It
exactly.
it's dangerous to call the police.
Exactly. That's
Mhm.
exactly right. Over 50,000 young people are injured by police every year in this country. And
What number?
50,000.
That's
And
a
so
lot of
when we
people.
think
That's a
about
lot of families.
public health, we count, right? We count things, we
Mhm.
count how many people are afflicted by a certain disease or whatnot, right? And so in the same way, public health has brought this lens to thinking about public safety of like, well, what is happening here in our communities? And of course, there's been a lot of sometimes there's negative attention on police for the violence
Mhm.
that they're causing. But just want to be clear, these are, you know, cities and voters and city councils that are asking police to do this thing
Right.
and creating legal structures saying this is how you police a community, right?
Mhm.
So this is not just an issue of how police are behaving. This is about what we as communities.
Have asked them to do.
Exactly. Exactly. So that's part of what the chapter that I wrote is about is how do we as communities think about we certainly are going to have a goal of public safety. We want you to feel safe walking in your neighborhood. We want everybody to feel safe. We do not want, violence, theft, those different things. I think that's sort of universal for
Yep.
humans, right? And then how do we do that thing? You mentioned some communities, especially those who have been disproportionately harmed by police, marginalized communities, Black and Brown communities, low income communities. Um, they don't even trust the police as a resource in many cases. And of course that's not universal, but the research shows that there's a segment of our population that will not call 911. Because they fear what might happen
Mhm.
when the police show up. So that's actually not a successful public safety model, right? And so one of the things I highlight is these unarmed non-police response programs that a lot of municipalities are innovating on. Cahoots is the most notable example. It's been in Eugene, Oregon for decades, but we're seeing programs pop up in Denver, in Durham, North Carolina, in other spaces, and they can look a lot of different ways. Sometimes they're grassroots, community led. Sometimes they're government entities.
Can you say a little bit more about what they're doing? Because I
Yes,
think that most of us would love to have a better sense of our own safety that doesn't just include the police, but has some additional, I'll call it closer
right.
sort of ties to who we
Yeah.
are and our communities we live
Yeah,
in.
absolutely. So these programs, at their core, what they're doing is they are providing another emergency response. So a lot of
So
communities,
can you call them?
you call them, they have a number. Sometimes 911 will dispatch them, but oftentimes they have their own number. And that's actually a really important thing for the communities that won't call 911 for fear,
Hmm.
being able to reach them through a separate number. And just like police or fire department, they'll dispatch. And the key here is that these folks are trained in care-based approaches. So they are going to respond to the emergency, trying to address the need in front of them, right? So if there is violence, they are focused on violence de-escalation, right? And you can see, what we usually ask our police to do is, yes, break up a violent instance, but also channel them into our criminal legal system, right? That's like a
Right.
core function of the
Yep.
police and what we ask them to do. This care-based approach of unarmed non-police response are often thinking about, how are we funneling these people into health promoting resources? So how do we connect them to social services, mental health resources, addiction resources, those types of things? And that's that prevention thinking, right? Because we know that those things actually help prevent
Hmm.
bad things from
Hmm.
happening. Whereas, you know, prisons, they actually, if you look at the evidence, don't stop repeat offenders and
Yeah,
that,
there's
that
no
type of thing.
rehabilitation within the prison
Yeah.
system. So when you were talking, I just got this image of almost like a human chain, where it's sort of like, okay, well, one person like links up with another person that links up with another person, and soon you've got like a bridge for somebody to be passed along,
Right.
so that they're not falling through the gaps.
Yep.
They're not left alone, because the biggest thing is the gaps,
Hmm.
right? Because you might be able to get them to one appointment, but then, well, what about the others?
Right.
Because most of the trauma that people are reacting out of, lifelong trauma, or childhood trauma that goes into adult trauma, that goes into,
Yep.
workforce trauma, it just keeps escalating.
Yep.
And that we have to form these, almost like these human bridges of support to
Yes.
others.
Yeah. Yeah. Absolutely. I mean, that support system. And I think, you know, and the core of this is that you're treating that person who, maybe made a mistake, if they were perpetrating
We all make
violence,
them. Yep.
or they, are suffering with addiction or things like that. You're treating them as a human being that,
That's transformative. Just
right,
that's a
right,
starting place.
that we want to rehabilitate. We
Yeah.
want them to be part of our community and our society. And so it's leading with that care and connection to resources. And the thing is now I kind of, I'll be honest, I come at it a little bit from an ethical standpoint of like, that person deserves care and is a human, right?
Mhm.
But there's also an economic argument for it, right? First off, imprisoning people is tremendously expensive.
Yes, it is.
In depending on what the median income is, in many places it costs the same to imprison someone as it does to pay like the median income in a locale. And so when you think about,
Can you say that again?
right,
So
it
the median income of a geographic area is basically the annual amount it takes to imprison somebody?
it can be about 40,000 per year to imprison somebody.
So it's almost like if you hooked up people and gave them the 40,000 to do the rehabilitation. That's mind blowing. Okay, thank you.
And that's where, I mean, that's where we're at, right? So like if you just talk about, you know prisons or policing or other issues absent the budget conversation, you know you might get to a different place. But the police are usually about 30 to 40% of a city's budget. And those
That's big.
unarmed non-police response programs have shown that they are actually cost savings. So it costs less to send out that response team than to send out the police. And then they are preventing issues. And so it overall,
Saving
you're
costs.
saving costs, right? And then you think about, if it costs approximately 40,000 to imprison somebody, what could we do with that 40,000? What could we do that would actually prevent things in the first place? Could we do to rehabilitate, to house people, to connect them to
Right, because these
social
people
services?
belong to families. They
Yeah,
belong to networks and
that's
communities.
right.
And so, and often it's, a real tragedy that they've been, in such a situation that they've been, in a sense, I'll call it catapulted
Yeah.
into whatever are the offenses. So we're running out of time a little bit. And so I want to sort of ask you like one more big question. If you had a dream of like, who would read this book?
Mm.
And you can say as many people as you would like, right? Um, how might they use the book? And how might they use this preventative thinking? So, I started with the setup of my experience is this is very accessible, great stories, has a lot of good details in it as well as good stories. Who do you want this to be read
Yeah.
by? What do you want them to do with it?
Yeah, I mean, the sort of shorthand I use in my mind is I want the doers and change makers in their communities to read this book. Not because I don't claim that this book has all the answers, not at all. But what I do think it can do is it can it can provide a little bit of hope, because I think there's a lot of different stories in there about individual people or communities that have made change or responded. It can provide a little bit of hope in the sense that this mindset can get us to a different place. And I think a lot of the people working towards change, they need a little bit of hope right now. So I think that's part of it.
So like teachers, physicians, clergy,
Exactly.
rabbis,
Yeah.
okay,
But I'm glad you're asking for a little more specificity, because when I say doer, right, it's everybody from the governor of our state
to
to
moms,
the grandma
dads,
knitting, but who drops off casseroles at her neighbor's house, right? Those are doers in their community. They aren't just sitting idly by and watching and complaining, although maybe some are complaining sometimes, we all do, right?
caring and complaining
Yeah,
sometimes go together.
exactly. But they are also kind of seeing what's outside their window, what's going on in the news, and they are thinking to themselves, what should I do about this thing? And that's what I think the book can offer, is just a little bit of inspiration, not necessarily in the sense of it's exactly what you should do, although I do think it offers some bit of a roadmap, but also just kind of inspiring and sustaining the doers and the change makers in our community to keep going. Maybe sometimes shifting mindsets. I know sometimes in my work, I get going on one path, and then something I read or talking to someone, it's like, oh, actually, maybe we don't want this approach. Let's shift gears in this way. And so that's what I hope it offers for folks. And we have so many doers in our communities at all different levels. And so I think those folks can find something in the book.
Thank you, Paul. Thank you for writing the book. Thank you for doing the podcast. I just want to sort of put Paul's book up here and say, each of us can make a difference. And, either read Paul's book or other books on how you might make a difference. The world certainly could use everybody's help at this point. So, see you next time. And until then, be safe, be well, and make a difference.